All right, so we'll go ahead and get started here this morning. So, just a reminder, we are recording. I just started that, and that's just kind of a reminder to be cognizant of what you're sharing, the things that you're sharing in this meeting, because this will be posted to our website and also on HICPUF's YouTube channel. Just for the folks who weren't able to join us in real time, they'll be able to go back and watch. So, just being cognizant of what you're sharing, that you're maybe not wanting just anyone to be able to hear and access. So. I have several team members here today helping me manage the chat, so you are welcome to use the chat for any questions you might have or anything that pops up for our presenters. I will be sending out the slides. It'll be posted to our website shortly. I just have to get the slides from the other presenters and put it all together, and it'll be posted with the recording to the website, usually in 3 to 5 days, so you can look for that early next week. And so we will have access to those slides afterwards. I know we have a few folks joining us by phone. So if you're listening by phone, welcome, hello. You are able to press *6 to unmute your line and *9 to raise your hand at any time. We welcome your comments. I have turned on closed captioning as well, so you're able to kind of manage that on your black Zoom toolbar, either turn that on and off just so you can see it. And then meeting information, again, will be posted to the Direct Care Workforce Collaborative website, which I'm going to post into the chat right now. That is where you can find this recording as well as past recordings, updated meeting information on this meeting, as well as our action groups, just a ton of great resources as well. So a great website to kind of keep in mind or bookmark as you are moving through. Just a quick overview of today's agenda. We're going to do some attendance, some polls, that kind of stuff. We're going to meet the leadership team. We have had some leadership changes, so we're excited to welcome a few new folks and let you get to know them. And then we're going to do a quick year in review. We are in December here, and so we want to reflect on all the great stuff that's happened over the last year and kind of prepares us moving into the new year. We have a vendor here to do some stakeholder engagement on provider reimbursement and workforce strategies. That's kind of going to be one of a couple different stakeholder engagement opportunities for that project. So we're excited to welcome Health Management Associate. And then John from our team is going to do a demo of the Direct Care Careers Hub, which is our resource and job hub. If you've been around for any amount of time, you have heard us refer to that as one of our ARPA projects, and it is live. So we're going to have John take us through that. Then we're going to have time for an open forum for your comments, your questions, your announcements. We just like to leave time and space for our attendees to get involved. And then we're going to close with a survey and some resources to share with you. So that's just a quick overview of what we have going on today. So with that, I'd love to get an idea of who is here. And I know we'll have a ton of folks kind of trickle in throughout the meeting. That's why we're going to stick really close to the agenda, because some folks can't join us for the full hour and a half. So they look at the agenda and kind of pick and choose what times they're able to join us. So for those folks that are here, though, I would love to get an idea of a roll call with your name, your location, and maybe your role and title or how you're connected to the Direct Care workforce. And if you're on the phone only, you're welcome to unmute and let me know, and I can make sure you're captured. So I'll give folks just a few minutes for that. And as we do a little roll call, if this is your first meeting, I do want to take just a moment to level set for you and welcome you. So this, again, is the Direct Care Workforce Collaborative. It's a stakeholder-led initiative that's made up of these quarterly collaboratives as well as bi-monthly meetings for our action groups. And those action groups are training and career advancement, compensation and benefits, and value and awareness. And you'll get a chance to meet those co-chairs or at least get their names and titles here in a few minutes. So we're excited for that. The purpose is just dedicated to just advancing the general awareness of the workforce, advocating for compensation and benefits for our workers, training and career advancement, and just recognizing the value of the direct care workforce as it relates to the entire healthcare sector, right? We call it the nucleus of healthcare. And that's something we'll continue to kind of preach a little bit, because it's so important for folks to continue living in their communities and in their homes. But it's only possible by having direct care workers. So really excited to be able to support them in this way. And the vision is just ensuring that folks, consumers and members are receiving high quality support and care from a workforce that's not only supported, but they're skilled, they're qualified, they're well paid, they're well respected, and that they have those opportunities to advance through their career as well. We want to be able to attract new folks to the field as others move in and out. And we want to retain the good workers and really just make them feel valued. So that's really the purpose of this. This meeting is just a lot of information around this space. We like to come together and share and really just get an idea of what's happening. There's a ton of great work happening, not just in our department, but in a lot of other of our sister agencies. So this gives us a chance to really bring it all together for you, so you have kind of a one-stop shop. So welcome if this is your first meeting, and if this isn't, welcome back. I think I'd go ahead and like to, it looks like we have about 50 participants, which should be able to give us a good idea of who's here with us. So I'm going to go ahead and launch some polls for us. So if you'll just hang on one second. And these are a little out of order. So I'm going to start us off with, where are you located? Which region do you represent? Where are you joining us from today? I will give folks about 30 more seconds. Hi, Steve. I see your question in the chat. If you represent all of Colorado, if you will just answer where you live, that would be great. We had statewide on here as an option, but a lot of folks work statewide, right? And so we really wanted to hone in on where you're likely sharing the information in your communities. So thanks for checking, though. I know that applies to a lot of folks. All right, that is stabilized. So I'm going to go ahead and end the poll and share the results. So we have folks joining us from all of our regions today, well represented in regions 1 and 2. That's pretty typical. That's where a lot of our folks are joining us from. But we do have representation in our other ones as well. We do like to hone in specifically on the ones that maybe are a little underrepresented. And so maybe doing some targeted outreach to those areas, or if you know folks in the southwest corner, maybe just the southern region in general, maybe invite them to this or share this invite. We'd love to do a one-on-one with them to let them know the work we do, just to get those folks' voices to the table. So thank you all for joining us from wherever you are from today. All right, second is going to be just how you identify on the continuum. What brings you here today? How are you connected to this work? Give another 15, 20 seconds, just a few extra people. All right, and that has stabilized. So let me end the poll here and share the results. So we don't have any direct care workers joining us today. We understand that it's a hard time. It's a hard time for a lot of us to join, and certainly for folks that are out supporting and doing the work of direct care workers. So I think probably the ask from us today is you're here, you're connected to direct care workforce. And so if there's something you hear in this meeting that you think would be beneficial, we would love for you to share it to a direct care worker in your life. And so that's kind of the ask for today. And then we have some individuals receiving services and family members. Welcome. Thank you for being here. We love our employers, our advocates, and our government agencies, of course. And if you selected other, we do have 3 of you. If you would like to drop in the chat kind of how you're connected, maybe we can capture you on our future poll. So appreciate that information as well. All right. And last but not least, we'd love to know how you heard about us. We'd love to reach more folks, get more folks here. So we'd love to know the best way to do that. Thank you, Julie. Yes, we need to have our education providers. We'll add that so you can fall into a category next time. Thank you. All right. Perfect. Thank you, Megan. All right, we'll give that just a second here. All right, that has stabilized. Let me share the results here. We want to say thank you to our employers and our advocacy agencies that continue to share this opportunity with their folks. HCPF newsletter communication. And so that is what we call the John Barry newsletter. It comes from John Barry twice a week. If you're not connected with that and you'd like to be, I'm going to drop a link in the chat to be able to sign up for not just this letter, but also other letters of our constant contact for the Office of Community Living. And there's also other opportunities in that constant contact to not only follow our workforce projects, but also other projects with home and community-based services within the Office of Community Living. So a great opportunity for you to check out there. All right, so with that, that ends our poll. So let me move us into Meet the Leadership Team and Year in Review. So at this point, I'm going to hand it over to our two co-chairs of the collaborative to kind of take us through who makes up the leadership team and what we've been up to this year. I think Penny, I'm going to hand it to you.
Brooke, thank you so much and welcome to all of you. As we approach so quickly the end of the year, I think most of us, we find ourselves moving toward periods of reflection and certainly periods of gratitude. And that absolutely is where I find myself. So for reflection, I remember back to October 2020 when there was a direct care workforce summit. And that's really how I first became aware of the important work. And it was at that summit that the beginning energy for developing the collaborative was born. And then subsequently in January of 2021, the framework for the collaborative, and looking at those with us this morning, many of you I remember from those very first meetings. So thank you for the work that you have done over these last 3 years. And to those of you that have joined during the last 3 years, thank you for your engagement and your commitment and your passion to help bring awareness and recognition to, as Brooke said, the essential workforce that represents the direct care worker that works across the continuum. At that first beginning of figuring out what this collaborative could look like, the structure was formed. And I think it's important for us to continue to reflect on where the strength of the collaborative, being a stakeholder-led, volunteer-led initiative, comes from. And I like to use the visual of a strong rectangular table that has 4 very firm legs that keep it in place. The first of those legs is made up of you, the collaborative. If it hadn't been for your engagement, continued and growing engagement over the last 3 years, this initiative, this effort would not be going anyplace. And thank you for the vision of identifying that compensation, benefits, training and career advancement, and developing value and awareness were the essential components to bring recognition to the direct care workforce. The second leg is really represented by Brooke, and special gratitude and thanks to Brooke for all of the work that she does all throughout the year to keep us organized, to keep us going forward, and to just send us quick reminders, don't forget. And Brooke connects the collaborative to critical stakeholder partners in HCPF and also other state agencies. The third leg of our strong table is the co-chairs, and Oliver Giminaro and I are privileged to be able to fit that particular role. And our job is to become the voice of the collaborative to outside stakeholders so that other people that may not be a part of the collaborative begin to be aware of what we're doing. The fourth, and excuse my visiting dog in the background, is where I really want to focus this morning, and that is on the tireless, creative, dedicated leadership of our action group co-chairs. Without the commitment of these co-chairs, again, the work of the collaborative that Oliver will showcase in just a few minutes would not be accomplished. So please join with me in expressing gratitude to our co-chairs for that undergirding action committee value and awareness, Brooklyn Ryle and Pascal Adu. Also, the tireless work of Deborah Lively and Ashley Weber, as the co-chairs of the critically important Compensation and Benefit Action Group. And our leaders for the action group in training and career awareness that are a critical stakeholder in the development of the curriculum that UCCS is developing. Please join me in thanking Jen Oakes and Brittany Chavez for the time and leadership. So with gratitude to all of you in the collaborative, with gratitude to our state partners, and a special gratitude to our action group co-chairs. Oliver, let us know what we've accomplished this year.
Thank you, Penny, for that great introduction and summary of what the Direct Care Workforce Collaborative does and for introducing our hardworking co-chairs. So to continue off that, just our introduction, our co-chairs are involved in I'm really impressed just the amount of work that they do in advocacy and different strategies around direct care workforce. They're very hardworking and it's really an impressive group of people. So that's one of we really feel proud about our co-chair group, and we've kind of gone through some different chairs this year and have some new ones. So we're happy and pleased with the people that are willing to work with us. We've had a lot of stakeholder engagement for ARPA projects. Right now, there's a public awareness campaign going on. I don't know if you guys have heard or seen any of the advertisements. It's on radio and some news stations, and there's some advertisings on, I don't know if you're in the Denver area and you've been down to the 16th Street Mall, some of the buses have some of our advertising on it. So we're really happy about that. We have conducted and are still conducting a direct care workforce survey. The results aren't out yet. The first wave has gone through and we're working on a second wave right now. But there also are other workforce surveys that have done, and the results are out, and those can be found on the HCPUF webpage. We're creating a standardized core curriculum, UCCS in Colorado Springs. There's a great group of people, and it'll be a training that anybody can access and learn more about the work direct care workers do. And you can get recognition for taking the class, and then you can use that if your employer wants, or to just show that you've completed these. And then there's some training grants that are available to ARPA through the ARPA grants. Just one in particular, they've done a couple of presentations, a group called Vital Hearts. They offer a program where caregivers can go and learn about preventing burnout and how to cope with all the stress that comes along with being a direct care worker. So we're really happy about those grants that are available to all people who are direct care workers. Our next, we're proud of our representation. The poll that we just took, we have all regions have been representative. We're still working on getting more and more workers, but we have had more direct care workers in general attend the meetings. So we feel like that's some good progress. And then we're really proud. Last year, we were able to get a proclamation from the governor creating Direct Care Appreciation Week. And it was the first year that we've done this, and there were tributes read on the House and Senate floors. And there were some direct care workers there in attendance. So we're just getting started with that. We're looking forward to next year's Direct Care Appreciation Week. And we're trying to work with legislature to make it more of a permanent thing. So always the first week of April will be Direct Care Appreciation Week. And then we're trying to we're working on making it bigger and providing some different opportunities during that week to, you know, let the word get out about all the hard work that our direct care workers do. Next slide, please. So this year we've had a handful of presentations. If you've attended, you've got to watch them, but I'll just review them real quickly. We had a virtual career presentation that aligns with ESL, English Second Language. And that was a really nice one. We had a presentation on the Direct Care Workforce Stabilization Board. And that's a new board that represents direct care workers, and it has industry leaders, and it has direct care workers and people that receive direct care workers. Help from direct care workers are all represented on the board. One of our co-chairs is represented. So we're excited about that. Connect for Health Colorado, that's our health exchange. And we had a great presentation about accessing that and how it can benefit direct care workers, especially if the benefits cliff, which we had a presentation on also, but it can really affect our direct care workers in a negative way. At a certain rate, you lose, if you're receiving Medicaid, you lose your Medicaid benefits. And so between the gap of when you lose it and the gap where you're made whole again is a pretty big gap. So we had a great presentation on that. We're really happy with our partnerships that we've created. One of our real strong partners is with the Colorado Commission on Aging. They also identified that the direct care workforce is one of their top priorities, and they really want that to be some work that they're doing. And they decided rather than recreating what we're doing, they wanted to collaborate with us. And so we have a great relationship with the Colorado Commission on Aging. Penny is a member, and it's exciting work that they're doing. The Colorado Workforce Development Council is another partnership that we're really proud to have, and we work with them. And then also with our connection through HCPF, or Healthcare Policy and Financing, we have other agencies, CDLE, CDHS, Early Childhood, and CDPHE are also our partners. So yeah, thank you for everyone again for attending and doing this good work and hard work. And I'll pass it back to you, Brooke.
Awesome. Thanks, Penny. Thank you, Oliver. Really excited to be able to just take some time to reflect on all of that. And of course, thank you for being here to participate in that and really help us move these ideals forward. At this point, I'd love to hand it over to our first presenter. Lee, I'll have you introduce yourself, kind of set the table for us and hop right in. So I will stop sharing and hand it to you.
Hey, thanks, Brooke. Good afternoon. My name is Lee Rapash, and I'm with Health Management Associates. And I'm working with Brooke and the HCPF team, or the department team, on a project to better understand the current landscape for home and community-based services providers, with a focus on access to services for community residents of inner city and rural communities in Colorado. I have two colleagues who have joined me on the call, and I'll let them introduce themselves before launching a presentation about what we're going to be doing today. Thank you. Chris and Andrew.
Thanks, Lee. My name is Chris Dickerson. I'm an actuary with Health Management Associates.
I'm Andrew Rudebush. I'm a consultant with Health Management Associates. Good to be with y'all.
So now what I am going to do is hopefully launch the right screen. This is always a moment fraught with drama for me. There we go. Give me 1 second, sorry.
You're fine, Lee. I will let you know when we see it.
I just really don't know about myself today. There you go.
Beautiful, thank you.
So as I said earlier, let me just reduce one screen to make sure I'm not on camera because I don't want to be while I'm reading. The Department of Healthcare Policy and Financing contracted with HMA to better understand the current landscape for HCBS services across Colorado. And as part of this work, HMA is engaging internal stakeholders such as HCPF and external stakeholders such as yourselves and other HCBS providers to analyze how HCBS providers currently get paid, as well as the potential impact of changes to how the state pays for HCBS services on access to care in areas experiencing provider shortages. As part of the first phase of this work, we created a dynamic heat map of Colorado HCBS providers, which can be used by the state to identify regional variations in access to providers, as well as areas where there might be gaps in access to providers or services, which we call care deserts, for Health First Colorado or Medicaid members. We're also going to use the heat map tool to identify potential geographic regions or locations where changes in the current payment methodologies might improve access to HCBS services and providers. In addition to engaging providers, I already mentioned that we'd be engaging internal staff. So what we're going to focus on with you all today is not the rates you're currently paid, but payment methodologies. So to do this, we're going to be asking you, and we're going to reconvene with you in January because we don't have enough time today to do a full stakeholder engagement. But today we're going to introduce you to the project, and we've created a Jamboard so you can begin sharing your thoughts on how you're reimbursed for the services you provide to Medicaid members. There's a focus on Health First Colorado. So we're going to ask you 6 basic questions during this engagement. The first question is, how has the financial adequacy of HCBS services reimbursement changed over time, and how would you assess the adequacy of current service reimbursement? Question 2 is, what is the largest non-financial barrier to delivering HCBS services to patients? Question 3, are there any state or federal Medicaid policy hurdles that make serving or expanding to rural communities particularly challenging? 4, do you find that some services, patients, or levels of care have sufficient reimbursement rates while others are underfunded? And then we'd ask you to provide specific examples of any applicable services, patients, or levels of care. Question 5, are there any services or providers that are instrumental to patient care but are currently not reimbursed? And number 6, are there any HCBS services, payment reforms, or innovations you feel would benefit Colorado? I'm going to launch the Jamboard where we've put the questions in a minute, and I will also have Brooke send you all this PowerPoint presentation. In the PowerPoint presentation, we've given prompts that will help you better understand the questions. And of course, you can always reach out to Chris, Andrew, or I with any questions you might have had about them. So when you get the PowerPoint, when you get the presentation, there's 2 ways that you can access the Jamboard we created. You can click here, or you can copy and paste into your browser. Once you click here, sorry, make myself laugh. It will launch you to this Jamboard. And what we've done is we've laid out the Jamboard with the 6 questions I just asked. And on each of those Jamboards, we ask if you can take a moment to write any suggestions you have or any responses to the questions. So I'll show you how you do that and how you go in between the different questions. How has the financial adequacy of HCBS services reimbursement changed over time, and how would you assess the adequacy of current service reimbursement? If you want to respond to that, and I think you're all seeing the Jamboard screen, I'm assuming that.
Yes, we are.
You can go over, and there's instructions in the PowerPoint too. You can click on a sticky note and drag it over. Or just click on it and it will open, and you can write your suggestion here. You can reuse whatever color you like. Once you've written suggestion, you hit save. It's going to automatically bring up another one. If you have nothing more you wish to add, just hit cancel and you'll see that your suggestion has appeared. You can move it if you like, you can change the color, and you can delete it, and you can edit it. Each question we're going to ask has its own little Jamboard. You use these arrows up top to go in between them. So this would be question 2, same process for adding a sticky note. Question 3, question 4, question 5, and question 6. And I'll figure out before I send this Jamboard out what 7 and 8 could possibly be. So does that make sense to everybody? Are there any questions about this? Now, we hope to revisit this in January with you and have a more robust stakeholder engagement session. But today we just want to sort of kick it off. And maybe if we have some time left with you all, we'd like to start seeing if anybody would like to talk about the first question. So do we have any questions?
I haven't seen any come through the chat yet, Lee, or hands raised, but we'll just maybe give folks a few.
Excellent.
And one final ask on the Jamboard, if you can please leave your region and the company you work for, that'd be great. We really appreciate your feedback.
Oh, I appreciate that, Andrew. I should be clear that that will really help us for the analysis we're going to do if you provide your provider type and your region. Excellent. So Brooke, since we have a few more minutes, would we want to, I just created a scribbly line on the Jamboard, don't ask. Would we want to dive into the first question and see if anybody has any input into that first question and use a couple minutes to start this off?
I think that would be great. Maybe if we could share the Jamboard link too, so folks could enter their own thoughts, or you're welcome to raise your hand or chat it and we can make sure it's captured on the Jamboard as well. But yeah, let's take a little bit of time.
I just threw it into the meeting. If you have any troubles responding to it, don't worry. And if you make mistakes like I just did and end up putting a red squiggly mark, do not worry about it. We will fix it. Excellent. I see people coming into the Jamboard as avatars, including dinosaurs, armadillos, bulls. I love it. So our first question is about how has the financial adequacy of HCBS services reimbursement changed over time, and how would you assess the adequacy of current services reimbursement? You can put stuff on the Jamboard, but if people are welcome to speak up now. Don't be shy. Excellent. I see a comment. Someone put a jam on the Jamboard. So targeted rate increases have improved rates for some services. Reimbursement has not kept up with increasing costs, especially labor costs, and that's great information. To the person who put that there, are you in a particular region of the state? If you could indicate that on your sticky or let us know, that would be helpful. Or is that if the comment's intended to be representative of statewide, that is fine too.
Yeah, we have the chat came in statewide trade association.
Okay.
For that one. Yeah.
And I'm just going to edit yours and write that if that's all right with you. Oops. And then I see increase in monies allowed more programs to thrive. Is that the rate? Are you speaking towards the rate increases over the past couple of years? And are there specific programs which have been, it's enabled it to thrive? I love this, seeing these pop up. And Andrew and Chris, of course, jump in if you have any follow-up questions on anything you're seeing posted right now. I'm excited to see there's comfort with this. I love Jamboards that way. Rural is difficult to service as travel reimbursements are no longer available. And that would be referring to that Medicaid does not pay for you to travel to members' homes. And that is what I'm seeing as an obstacle. HCBS reimbursement has historically been underfunded and too low to support adequate DCWC direct care workforce wages, while also covering the other required costs of doing business. Do you want to talk a little bit more about what those other costs are?
Well, sure. This is Lauren Chevalier from People
Hey,
Care
Lauren.
Health Services. So that was my note. And it is a very long list of regulatory requirements and just good practice for managing the safe and efficient care delivery that requires significant capital in order to keep an agency functioning and thriving. So some of the specific requirements. So, yeah, there are training requirements. Part of that is being addressed through the collaborative and the Colorado Direct Care Workforce Training Program. But the staffing required to administer home care delivery and to manage and oversee the direct care workers is significant, because we don't just put caregivers out into the field, close our eyes and let them go. There are care coordinators that have responsibilities to manage each client, changes in condition, continuing stay, assessments and reassessments for those clients. All of that, it needs to be in place. There needs to be sufficient backup for caregivers who call off and do not go to their scheduled visits, which sadly happens more often than I think we all would like to think happens. There's a lot of IT expenses. So we have to have electronic health records. We have to comply with the electronic visit verification requirements. And there's insurance requirements that are very significant, many different types of insurance, that some are there by regulatory requirement, some are there just as a requirement of doing business and protecting against catastrophic events. So I can go on and don't want to take more time in this forum, but I am happy to sit down with HMA and provide an itemization of the significant cost structure that needs to be in place in order to manage a home care business under Medicaid.
Lauren, this is wonderful. If you want, I popped my email into the chat, and Andrew and Chris can also pop theirs in. If you want to contact us, we'd love to sit down with you if you're willing to share your time with us and follow up on some of this. This is great information.
I'm happy to support your research because it's very important.
Excellent.
And Lauren, another comment, I appreciate hearing some of the policy challenges, and that's going to lead well into questions 2 through 6, where we try to get at some of the non-financial burdens, because I know it's always tempting to say that more money could solve the problem, but that's not always a feasible solution. So we are very interested in some of those policy or regulatory changes that could ease the provision of services, help you meet the members' needs, and yeah, that's going to be something that we'd love to dive into further.
And Chris, just quickly, one of the biggest policy challenges was something that Brooke mentioned earlier on, where I think actually maybe Oliver mentioned it, and that is the benefits cliff. Because increased reimbursement that is funneled towards increased wages do not ultimately improve the standard of living of the direct care workforce because of the benefits cliff. So you can keep pumping additional money into it, but when they lose their benefits on the back end, the net effect is stagnation and not the desired increase in net wages, improved benefits, and improved working conditions. So that is key. And it's a big issue, I think, nationwide that needs some policy action.
That's a really great point, Lauren. And that is a big issue nationwide. We'll be following up with you just now. If anybody else also, now we have Andrew, Chris, and my email. You're welcome to email all of us or one of us or any of us, and we will follow up with you. You also can email comments to us directly if you're not comfortable with the Jamboard. That's always fine. I see a couple more. Documentation and regulatory requirements have increased substantially without funding to cover them. So these are administrative costs of doing business, I imagine. And thank you, Andrew, for leaving this sticky. Please be sure to add your location and company organization name to sticky notes. I think these are general thoughts, so here it's fine. But in more specific, it will help our analysis if we know what region of the state you're located in. So we can take a little time with question 2. Brooke, I don't know how much question we have left, and people are welcome to keep jamming on question 1.
Right, we have about 10 minutes. And if we
Excellent.
could maybe reserve a few minutes, Lee, at the end to just talk about the best way to connect with these folks for those January engagement sessions, whether that's an email invite or if they just want to connect with you guys separately, just maybe talk through what that could look like to be involved down the road.
Excellent. So we'll do one more. Again, this doesn't close. This won't close until January. And so you will have plenty of time. If thoughts occur to you in the middle of the night, whenever it does, you're welcome to go to the Jamboard and add them. The second question is, what is the largest non-financial barrier to delivering HCBS services to patients? And we heard some of that in question 1. Some of the notes here are about this, these non-financial barriers, such as travel, regulatory hurdles, policy hurdles. So any other thoughts on non-financial barriers to delivering HCBS services? And feel free to speak up too. Excellent. And it's all right if you don't have comments today. Again, this will be open through January. And in January, as Brooke said at the end of this, we'll talk a little bit about how we're going to re-engage in January. Excellent. I'm seeing some kind go out. Caregiver burnout. That is a great one. The tight labor market and shortage of direct care workers is a very significant barrier to meeting the demand for HCBS services. Thank you, Lauren. Is this regional, or can you speak to if there's more less of a challenge in, say, urban areas than rural and frontier areas?
It's everywhere. It is throughout the state. It is nationwide. It's the subject of lots of research and a lot of documentation.
Mm-hmm.
It is a nationwide issue. There are many causes to it, but part of the, I mean, I think it is exacerbated in the rural parts and the frontier parts of the state where just the density of the population is lower. So the availability of individuals who are looking for jobs in this space is also lower. And the flip side is there may be an inordinate, a disproportionately high number of Medicaid members living in the lower cost rural and frontier parts of the state relative to the number of DCWs living in those same areas.
It's a great point. Thank you, Lauren. And I'm just making notes for myself. The tight labor market, caregiver burnout, very serious. Lack of professional development opportunities for direct care workforce. That's a really good comment. Covering shifts when someone calls out. These are great. So I hope, difficulty having, excellent. Northern Colorado is an area of great need, particularly the Northeast. Difficulty having workforce prioritize work. Families are not as resilient. They are sick and overwhelmed. That's really nice. That's a really great point. Okay. Well, Brooke, we can take a few minutes to summarize what we're going to do moving forward. Please know again that this Jamboard, you can bookmark it. It's going to be open. We're going to send you the slide presentation after this meeting, or I'll have Brooke send it to you. It'll probably be easier. It includes a hot link to the Jamboard and also some prompts if you need. Sometimes I need prompts to help think about what the question is asking, and I'll go and it will be available to you all through January. So Brooke, as Jamboard, as jams, I don't know what you call them, as notes are going up, do we want to talk a little bit more about what would work best in January for the group?
Yeah, I think so. I think you have a lot of providers here to speak to kind of the best way to connect with them. And then obviously we can kind of use that to connect with other outside providers that aren't able to join us today. So just kind of what the best
Yeah.
communication technique is.
We would ideally, we were thinking we would set up an hour to talk to you directly outside of other venues, outside of regular meetings you have, but we know how important your time is to you and how you don't have a lot of time. So we may be able, Brooke, to leverage one of the future monthly collaborative meeting. But that would be up to the group how we want to do this. And we can send out some ideas. We're also willing to engage on nights and weekends. We don't want to take your time at nights and weekends, but if it works best for everybody, we will be there. And what we'll be doing in January is following up on what we learned on the Jamboard. What else is on the Jamboard? So if you go through the different questions, excellent. I see people are answering different questions. And I'll figure out what 7. Oh, good. It's nothing. It's just an extra Jamboard. So you can go through to any of the Jamboards and respond to the questions using sticky notes. And in January, we're going to follow up on what we've learned, as well as try and engage you more on these questions and maybe dig a little deeper from what we've learned from the Jamboard. So is there a way to poll people, Brooke, on what way they like to do? Or is there, I need to ask you if there's a potential to hijack one of your January meetings?
I know we have a handful of co-chairs here, so we won't have a quarterly collaborative meeting like this, but we will have our hour-long action group meetings. Training and career advancement is kind of booked just on our other updates and stuff, but we might be able to talk to, let's see, Deborah and Ashley are both here about bringing you all to our compensation and benefits action group meeting. And then we also have value and awareness. I'm thinking that perhaps this might be a fit for compensation and benefits, at least in some degree. So I don't know if Deborah or Ashley would like to pipe up and say if that's okay or not, or if you had other agenda ideas, but Deborah's saying I agree. So we can certainly take over part of that meeting. They're typically an hour long, but if we have a couple other agenda items, we might just be able to ask folks to give us a little extra time for that if they're able. If not, we'll certainly record. So, and Ashley's in agreement too. So I think we can certainly take advantage of that, which is, let me get you a date, Friday, January 19th at 10 a.m.
January 19th, 10 a.m.
Mm-hmm.
And Chris and Andrew, I will make it happen on my calendar. And hopefully Chris and Andrew will be able to join us. But let's count on that. Let's schedule that. It sounds great. This is a great group and we'd love to hear more from you. Again, leading up to that time, use the Jamboard freely. Brooke, I'll send you the, I can attach it in the chat too, but I will send you the PowerPoint so people have that quick link. It will be in PDF format in case, I think everyone can open PDF. If not, just get in touch with us and I'll send the link. And again, our emails are also included in the PowerPoint presentation. So I really appreciate everyone's participation today. I'm very excited about the early enthusiasm for this project, and we look forward to learning more from you all. And Chris and Andrew, anything to add?
Just that the Jamboard to stay open. If you guys can keep adding thoughts to that, like Lee mentioned, as time goes on. If we, see that maybe some of the questions don't have many stickies posted, we might try to use Brooke to bump the group for a little more feedback if that's acceptable. But yeah, we really appreciate all of your thoughts on the various questions that are in the Jamboards, not just the 2 that we focused on in our limited time today.
Perfect. And I don't want to speak for HMA, but if you have folks in your either colleagues or other organizations you work with that you think would be also interested in this information, we'd love for you to share the Jamboard. And I'm sure Chris, Andrew, and Lee would love to answer any questions they might have as well, just about the project in general and what we're trying to do. So yeah, that's the ask for today. Thank you so much.
Well, thank you, Brooke. And yes, we are available to answer any and all questions, and do not hesitate to contact us. And Brooke, you can, when you send out the presentation, you can also, if you want, in the body of the email, include our email addresses. We want to make this as easy as possible for everyone to contribute.
Thank you so much. We appreciate it. And this will not be the last time you hear from these guys. So we're super excited to have been able to introduce it today and continue to work with them as they put this together for us. So all
Thank you so
right.
much.
Thank you. All right, with that, I would love to hand it off to our second presentation. John, I think you are ready to share or able to share when you're ready.
Great, thanks so much, Brooke. My name is John Hendricks, and I'm here today to chat with you about ARPA 1.04, the Resource and Job Hub, or directcarecareers.com. I'll just drop a link into the site for everyone here. So if you're unfamiliar with Direct Care Careers and this, can everyone see my screen here?
Yes, we can, John.
First of all, thank you. Direct Care Careers is a resource and job hub for direct care workers and direct care providers. So what it is, I kind of describe it as a combination of LinkedIn and Indeed, where with Indeed, you can kind of look for, employers can post jobs and job seekers can find jobs. So it has that aspect to it, and it has auto matching as well. So that if someone comes in and shows you and puts in their resume and it lines up with the job posting, it'll actually auto match as soon as you put your information in, and then job seekers and job providers can get connected quite quickly. So we're going to go over both sides of this as well, because there's the other side, which is kind of the LinkedIn side, which we're going to have training modules on the site. We have resources loaded on the site, and it's kind of an area where direct care workers and providers can actually collaborate and chat with one another and ask each other questions. So a few little background on this. We soft launched back at the end of September, early October, and we did a beta test with about a dozen providers just to test the site and make sure that everything was working and everything. It was sort of what providers were looking for on the site, and that it worked for them. So if you're a provider and you attended one of our beta trainings, this is going to be more of an overview. However, we do have links to sort of a step-by-step and also kind of click by click on how to get into the site, how to sign up, and so forth that I'll share with you at the end of this presentation. But first, what you would want to do is first coming to the site, you want to click on your state, which is Colorado. And once you get here, you'll be presented with a few options. The first up here, if you have trouble with anything like logging on or have any questions, you can click on the question mark, and this is going to take you to kind of the help library. So it has PDFs on if you encounter troubles logging on. This is the first place to the second, this is just to switch between states, which you will probably never do, but we'll go back to our login page. So there's two separate sides. There's one for the employers and one for the direct care workers. If we look at the direct care worker position first, we'll drop down on that caret. You'll be taken to the login site. So for a direct care worker, it's pretty easy to sign up. You put in your name, your email, and then you create a password and select the role that in the workforce that you are. If you're a certified home health aide or a direct care worker, or a home caregiver or a homemaker. And you would need to agree to the terms of use, saying basically you're going to use this appropriately. You're not going to create fake resumes and things like that. And then you would create a new account. I've dummied up 2 accounts, so we're not going to go through this process, and we'll log into those. However, the process for an employer and a provider is a little bit more, not complex, but there's a little bit more that goes into it. So what we need from providers is provider verification. So this site is really only up for HCBS waiver providers at the present moment. So if you're not an HCBS waiver provider or a home health agency, you probably won't be able to gain access to this site. So we would need your provider name, your tax ID without any dashes goes in there, your provider email, and this email can be your personal work email. It doesn't have to be anything specific, and your zip code. We pull this report from the information that you sent into the site. So if your provider name is a little bit different from what was submitted. Say that there is a comma after Inc., or maybe there isn't a comma after Symphony Healthcare Inc., then that will not let you in. One of the ways you can check this to make sure that you have the correct information is if you go to this link, which is just healthfirstcolorado.com, and you look up your agency name, it should populate as to how you had submitted it, and then you would use that name for the provider name, and of course your tax ID number. If you have any issues and you're not able to log into the site or verify your information, you can come to the help desk link here and let them know that you're having trouble. And if they're not able to help you, they'll contact me and I'll get in contact with you, and we can go through and try to troubleshoot that. I usually just set up like a 10-minute video call just to walk you through the process and help you get signed up.
Hey, John, can we take a minute for a couple questions?
Sure.
So Cindy is asking, can you tell us how many jobs, and stop me if you're going to get to this at some point in the presentation too. Just tell me to wait, hold my horses, right? Okay. Cindy's wondering if you can tell us how many job seekers have signed up yet, excuse me. If you're able to tell us that, or at least a ballpark. I'm not sure if you can.
Yeah, I do have that. I wasn't going to get into that, but I can just bring that up real quick. So we do have a number of job seekers that have signed up for the website right now. And at last count, I last looked at this, I think, on Friday. So we have 72 candidates signed up as of Friday. And I know that more have come in over the weekend. So it's probably around 80 or so right now.
Perfect. Thank you for sharing that. And then you might get to this, but Judy is asking, once an employer or direct care worker has signed up, can you show us how the training curriculum will be accessed?
Yeah, I can show you how the training curriculum will be accessed. We don't have the modules quite yet to show you how that's going to look, but yeah, we will get to that here in just a minute.
Perfect. Thank you, John. That's all for now.
Thank you. All right. So once you've finished your provider verification, or if you're a direct care worker and you've signed up, you do not have to do this portion of the site when you come on the next time. You would just want to come up here to the silhouette and click login, and then you can access your profile from there. So that's what I'm going to do. I'm going to go to the login, and I am going to log in first as a direct care worker. So we're going to be, let's see, I just changed all of these, so it might not be on here. And if not, it might just take me just a second to re-enter this information. I do apologize, but I do have it here written down. Give me 1 second. And if you have any other questions, just let me know.
No problem, John. If anybody's going to forget their password, I'm assuming it's going to be Elmer Fudd. So.
All right. Success. We're in. So once this looks very similar to something when someone actually just signs up. So it's going to bring them to their workspace dashboard first. And this kind of has just general information about what role you chose, your resume, if you've uploaded it, which you haven't yet. And then just sort of what trainings you've completed, what badges you've earned, certificates you've received, and skills acquired. And that really goes into the credentialing and training catalog, which we're going to go into here in just a little bit. But first, folks can come into Edit My Account, which will just help them change their passwords and things like that. The second portion of information that you would fill out is just your personal information, your date of birth, your address, where you're located, and your contact information. I will say that if you are a candidate and you're filling this out, it is very important that you fill all of these tabs out. I know it can take some time, but if you do not fill this information out, then you will not be auto matched, because what happens is the information that you put into the section, like where you live, will go into to connect you with the job posting. So if there's a job posting and it's only for Durango, Colorado, and you live in Salida, and you don't put that information in, it's not going to match up. So if you don't put in that you're also from Durango, it's not going to come up with the jobs that are in your area or are around your expertise. So these are very important to go ahead and fill out. Second is going to be work preferences. So there is a little box at the top here. So if you are someone who is currently looking for work and you want to be matched with a potential employer, this is always checked off automatically when you come in. So if you're someone who works for a direct care agency, because this website is not only for job seekers, but it's for individuals that already are in the direct care field or already associated with an agency, you can deselect that and say, like, I'm not working for work right now, and you're just sort of here for the trainings or the resources. But for now, we're going to say, like, yes, we want to be matched with a potential employer. So the employee would come into here, and it's just general information about what role you're looking for, what availability you have, when you can start, and also kind of like what schedule you're looking for as well. Yes, and it asks various questions, like what kind of support you can provide, and what you have experience in, and the distance you're willing to travel, if you are willing to travel to multiple locations. So it really gets into the nitty-gritty about where you are, what you can do, and how far you can travel for work. And again, the employers are asked very similar questions so that when the job is posted, they'll be able to match with the best applicants who are out there. And again, you can put in, what your minimum hourly rate is requested, and also what your requested salary is. But that is absolutely optional. And it also goes into kind of like, what are your days? Are you able to do part-time, long hours, short time? If you want to mentor someone, or even to seek other training. So that's, the work preferences. The work experience, this is really where you would put in your past employers. So you can put in all of your employers that you've had in here and put in new employers. So it's very, very similar to other websites that you would post jobs on, such as Indeed and all, and Monster and all of those types of things. If Monster still exists, I don't even know. At this point, I feel like I'm going a little fast. I just want to slow down a minute and see if there's any questions before we continue on with the candidate.
We don't have any more in the chat, or Oliver has a question. Oliver, please.
Oliver.
Hello, John.
Hi.
I really appreciate this, and I think it's awesome. The shortage of direct care workers is a real problem. My question is this set up? It looks like this is set up mainly for agencies. In Colorado, we have a pretty strong consumer direct group of people that are also looking. Is this available for people who direct their own care, or is it only available to agencies?
At the present time, it's only open to agencies. However, for the consumer directed folks, we're going to open that up to those individuals in the new year. And so if you're a consumer directed, we do have a report for everyone who is a consumer directed and is a part of CDOS. So those folks will go into the system just like an agency will, and they will have to verify their information just like an agency. But once that's up, they can come in here, they can get connected with a direct care worker without the agency being involved as well. Yeah, that'll come in the new year. Thanks for your question, Oliver. Again, for the workspace, this is just an area where someone can come in and put in their year graduated and what their school was. It also lets you upload your diplomas and certificates and any technical qualifications or additional trainings you can add into this area. So if you've done mental health first aid or QPR or anything like that, you can put those trainings in here. And then that's something that also will be able to be seen by a provider agency or CDOS in the future. Yeah, diplomas and certificates you can load in there. And that's another great thing about this website is that you can load all of your certificates, all of your information, and you'll have them stored in one spot so that you're not. I remember when I was doing direct care work, I was like, I can't even remember when, my certificates were going to expire and they were kind of here or there, loaded onto a jump drive. So this is really an opportunity for folks to get all their information in one spot and have it all at their fingertips. Going forward, you can put in your credentials. So we have, like we were just talking about, if you've taken CPR first aid, you can put in when it was valid for and when it's valid till. If there's a credential that's not on that list, you can always add in other credentials down below and enter the same information. But again, this is just another way for people to get their information in one spot and to just showcase all their experience and what trainings they have gone through. Because as we know, with direct care workers, if they're in one agency or they go from one job to another, their training doesn't necessarily go along with them. So part of this website is to make that training and their skills portable so that they're not taking other insurance or other trainings over and over again. And then hopefully that's saving the agency money, saving the person money, so they're not spending money on additional trainings that are redundant. Under additional information, this is basically just kind of I encourage people to just throw in like a brief biography of themselves in here just to give them an idea of who they are, what their experiences is, and what their background is. And again, the more information that candidates put into this, the better and more robust their information will be for a potential employer, and the better the chances they would be to find the job that's best for them. This is also where they will upload their resumes, their cover letters, and their reference letters. So when they're auto-matched with someone and the provider sees it, they can see all of their information and have everything at their fingertips. So we'll go into that next when we go into the provider side of the website. And from the dashboard, now that I am the direct care worker, I put all of my information in. If I scroll down to potential jobs, we'll see that there is one. We've already been auto-matched. It's for Acme Corporation, which is an attendant. They're in Steamboat Springs. They have a list of needs. So if I was interested in this job, I could go to view details and see where they're located, when the job starts, what type of services are needed in this role, the days, everything that you would need to know, and the pay scale as well.
We do have a few questions, John, if we can just pause for a moment. Yeah, you bet. Sure. So first, and then Judy, I'll get to you. Annie is asking, how do direct care workers generally come into contact with this site?
Right now, we've been doing a sort of part of the public awareness campaign. We've been doing a lot of social media posts. So those have been going out. If you see them on LinkedIn and our website, and I think Twitter and Instagram. So that's mainly where we've been seeing those come from. We've also done a call to action campaign to various different community stakeholders. One we just did was to all of the workforce centers. So we sent just a call to action letter letting them know what the website is with links. And we also sent flyers out to those individuals as well. So a couple of weeks ago, we also sent out a lot of letters to known community health nonprofit organizations and to federally qualified health clinics, just to let them know about it too. So we've been spreading the word through those avenues.
Perfect, thank you. Judy, please.
Congratulations, John, and your team. It looks great. This is very exciting. And I hope maybe our next advisory group meeting, you could bring that probably in that letter that you want to go out to contact direct care workers. My question is, and I'm assuming that the training catalog is where the CDCT curriculum is going to be housed. That's an assumption on my part. And can you tell us a little bit about how those module completions will be cataloged here?
Yeah, so if we go to our workspace, this is where they will be housed. This is like sort of like if someone
Okay.
goes in and does that training, they're going to be able to put it on the trainings completed. They'll get badges for trainings that they have completed as well, or items that they have completed on the website, and any certificates or skills acquired. So this is something that if someone is looking for a candidate was looking at, they could come in here and look at this and say like, oh, these are the trainings that they've completed and the experience that they have. But it also, again, is for that portable training issue, so that this is not only for individuals to showcase for job opportunities, but it's also for people who are already working in the direct care field. If they come in here and they do one of the trainings that are going to be coming to the website in 2024, in the spring of 2024, they can have all of their information in one spot, because I'm as a direct care worker, you go through so many trainings and you learn so much, like it can get lost in the shuffle of where all of your accomplishments go. So this is really a place not only to, if you're looking for work, to showcase it, but also to store all of your trainings and your entire catalog of what you've done as a direct care worker.
That sounds great. Thank you so much for that, John.
Yeah, absolutely. And we'll get into kind of the sections of the website once we've gone through the provider. So I'll get to that too, Judy.
Perfect. And then Teresa, please.
Oh, yes.
Hi, thanks, John. You
Yeah.
mentioned that you had, this looks great, by the way, really good. I'm very excited about this. You mentioned that you sent flyers to the Denver Workforce Centers. Is that correct? Because I'm affiliated with the Denver Workforce Centers and I just didn't get anything, or maybe my colleagues did and I did not see them. So can you tell me to whom you sent them or when, and I can follow up on that?
Yeah, absolutely. I believe I sent them the end of last week or the end of the week before. I can get in touch with you. And I actually just used the general emails. So it was like if you have an info at, that's the email that I sent those to. But if you would like to throw your contact information, I'm sure I have it in an email somewhere from you, Teresa.
Sure.
I can go ahead and forward that email to you as well.
That'd be great. Thank you so much. Thank you.
Yeah, for sure.
Perfect. That looks like it, John, for now. And just a quick time check, you're about 8 minutes left.
Oh, my. Okay, we'll get going here. So I'm going to jump into the provider side of things, and this is a little bit easier, I would say. So I'm just going to go ahead and take this in. Let's see if this one works. This one's great. Work that time. So this is for if you are an employer to come into, and once you've signed up and you've verified, this is what you see. So you have your account details, and you can go into edit my account. Same deal here. If you want, you can choose a picture. If you have your logo, you can throw that up on there. But otherwise, this is pretty much the same deal. You can come in, change your email or your password. And then for your job post, this is where you want to start posting your job. So we can go and you can say, if you have a job post template, say you're setting up the same job multiple times, and you don't want to come in and do all the clicking and putting in the same or similar information. But if you have jobs that are very similar, you can create a template to post those very quickly and easily. But we have the job post, and this is very, very similar to what we already went through on the other side, and similar questions to help with that automated matching feature. So you come in and put your job title, where you're located, and then again, similar information like what type of services you're needing. If there's services in here that you're needing that aren't on here, you can actually put in other services down here, and it'll come up on the job posting as well. Like your minimum qualifications, we put in like what we felt like were, and what we received feedback on that were the most important to folks. And again, if there are other minimum qualifications for your agency, or if you're a CDOS member and you want to put in other minimal qualifications that you need, you can throw those in here as well. And again, we ask similar questions: adults, who do you want to work with? Adults, children, or other adults? What kind of needs are needed for this particular job? What environments will they be in? Will there be animals? Will there be any like kind of environmental things going on? And also like a language preference. So if you're looking for someone with only English skills, you can select that. Or if you need someone who's bilingual in Spanish or Chinese or Arabic, you can click on those and add those. Other languages, you can put any other language that you're looking for. I saw one provider throw in Russian on there when they were looking for someone. And then, of course, just putting in, when you need this person, like how many days a week and what times, and if there's a day or evening or overnight. So that all goes into and kind of matching up with the candidate profile. At the very bottom, there is an important checkbox, which basically says like, if you want to make the job available. So if you do, you want to click on that. And I have actually done this with another. So I'm going to go back to, pardon my scroll, my profile page here. And if we scroll down, excuse me, I need to see my job posts first. If we scroll down to the bottom, pardon, I'll scroll again. We'll see that there are top matches for candidates within that that job posting. And again, this is Elmer, who we met before, and we saw that matched to the other. So that is one way of getting your job posts in there and people in this as well. And then we have sort of the employer profile. So if you're an employer who has multiple sites, you can actually come in here and choose that you are corporate with multiple locations. And that way, multiple people can be in the same profile. So if you come in and you create an individual employer profile, and all of your affiliates do that as well, you won't be able to share the information, share the job postings. So this way, it's just a way to bundle your entire organization into one account. And you can also manage your members from this area as well. So if you come in, and I'm going to switch my screens. Can you see where it says resources here now on the screen?
We can, John. Yes.
Thank you so much. So we have several places in here. So resources is one. So right now we have about 300 resources on the website. So if you come in here and you're looking for something for like insurance, for example, you can look for insurance resources on the website, which comes up with direct workforce and state-based insurance programs. We also have topics on the side as well. So if we want to go back to resources, pardon me, just take a minute. You have a list of topics to choose from as well. So if you were looking for cultural competence in healthcare, you can select that and you'll come up with a list of cultural competence information and trainings as well here in the Resource Center. The training catalog. So this is where Judy was asking. This is where our training catalog is going to be housed right now. We don't have any modules in here. So as soon as we do, this is where they'll be housed. And if you're familiar with Rise, that's the platform that we were going to be using. We've tested it out with one that Judy had sent us, and it worked very, very well. Let's see here. So right now for the training, we have key concepts of direct care, for example, infection control across work settings, household duties, and direct care, observing, reporting, documenting. So sort of those base knowledge trainings are going to go onto the website first in the spring. Do I have time to go over just a little bit, Brooke?
Yeah, you did. Well, actually, John, if we could just maybe pause for a second and get the open forum, I can ask for open forum comments just to make sure that everybody that has something to
Sure.
announce, and then I'll just let you continue sharing your screen and then just jump right back in before I do resources. So we'll just pause for a second here and do just open forum announcements. I know I had a couple of folks reach out to me, so the floor is yours. Anyone and everyone. And so just a reminder, just in case you haven't been to one of our meetings, we like to set aside just a little bit of time for any questions you might have or resources you'd like to share, announcements you'd like to make. One thing I'd like to point out, just while folks kind of drum up some some resources to share, is Heather did drop the public awareness campaign link into the chat a little bit ago. I might just recopy and share it. That is active right now. It does have a link to the direct care career site that we're going through right now. But there's a ton of other information on there as well. Some videos, some like infographics and slides that you can use in your own work in recruitment and retention, and just that awareness piece. And so we really encourage you to check that out. And that'll run through, I believe, February of next year. The site will remain active after that, though, as long as it's relevant. And so check that out just to kind of push that public awareness campaign as we move into the new year. And then I'll pause for just a few other folks, maybe. And I got a message from an iPhone user. You are welcome to chat if you are able to come off mute. I might be able to do that for you. Let me see. I'm going to ask to unmute for you here.
Oh, yeah. Can you hear me, Brooke?
I sure can. Yeah. Thank you.
Yeah. Well, thank you guys. Yeah. And yeah, thanks for letting me sit in. So yeah, Brooke, I had reached out to you a few days ago, just asking if I could sit in on the meeting and just talk for a few minutes. But it's actually really been super interesting listening to this, like super interesting. So I'm the mother of my son's a high spinal cord injury, so he's a quadriplegic. He was injured in college a few years ago, and so our the reason I was on is that we're part of kind of this grassroots group that's getting together, trying to work with the Christopher Reeve Foundation around care specializing in paralysis and spinal cord injury. So this particular person also is she's also a writer for the Christopher Reeve Foundation, and she's been injured, I want to say right around 6 years or so, but she's been left high and dry a few times, where she's been spent the night in her wheelchair overnight, and she has no feeling or movement below her neck. So we all started chatting about how difficult it is to get caregivers, and all the things that you're talking about. I mean, getting caregivers to stay on, getting communication. I mean, just keeping and getting caregivers. I mean, just obtaining caregivers being so difficult. So anyway, our little tiny grassroots committee, very, very small, I want to say maybe like 6 people or so. This is kind of what we're trying to do then through the CDOS model. And I mean, currently, kind of like what your site's saying, we're trying to figure out, how to advertise, how to get the name out there that so many CDOS participants, need good caregivers. And then we're also trying to work something where a caregiver would be specifically trained for SCI or paralysis, because there's a lot of specifics to spinal cord injury. A lot of specific, again, just really just to that injury. So that's another thing that we're we're also looking at. But and then I also just right now we're also working a little bit with Craig Hospital. I mean, because one of the things that we're trying to do is establish training sites, whether it's online videos, Craig Hospital collaborating with other agencies, but getting a training program that that again would be a little bit more specific to paralysis and an SCI. So but your direct care career site is really awesome. But I didn't realize actually until just now. Well, obviously it's new. It obviously hasn't gone live. But it would now to agencies. It sounds like, but it sounds like it might open eventually to CDOS members in 24. That's at least that's kind of what I heard. But
Yes, yeah.
But anyway, just obviously that your site sounds fabulous. 300 resources, and then links to training platforms and et cetera. That's of course, that's awesome. That's incredibly awesome. But anyway, that's just what I wanted to mention in this meeting, because we started with an agency when my son was first injured. And when my son was first injured, we didn't even know what to do. It was just horrific. And then eventually found, an agency, figured out how that worked, and then, eventually moved to CDOS for miscellaneous reasons. And, of course, that's that's interesting. That's a real I have to be honest with you, because when working, because I also worked for the agency too, and you really have tremendous amount of respect for an agency when you're running CDOS, because it's only my husband and I. And wow, when you have two people that have to run everything, because my husband's the AR for my son, because he just wouldn't be able to run it. He's just he's got ADD, and it's just tough for him to do. But it's just a tremendous amount of work. I applaud agencies, and I applaud anybody on CDOS at the same time. So anyway, that was just my comment, because I don't want to take too much time. So.
Well, thank you very much, Lisa. We're so happy that you're here. And I've had a couple folks chime in, send me private messages to connect with you just about what you guys are doing and maybe some overlap. So I'll reach out to you after the meeting, and we'll get you connected with a few folks. So that's great information. And we're so happy you're here. So thank you.
Great. Thank you. Thanks for letting me speak. Appreciate it.
Yeah. All right, John, I'll send it back to you. And for those in attendance, I'm going to drop some links in the chat, but we're going to let John take us home.
Thanks so much, Brooke. And I apologize for going over. But real quick, this won't take too long. There is also a collaborate section. So collaborate is just basically just for providers, individuals to kind of ask questions of each other and get information. Collaborate, I need you to know that it is not like an in real time post. What happens is the posting will go through, it'll come to us, we'll kind of vet it for appropriateness, and then we'll post it later. So just in case you have questions on why my post didn't go up, as soon as I put it up there. This is really just an opportunity for people to kind of, play in a sandbox here. We also have the contact us. So if you have any questions with the website or have any issues, this is kind of your go-to once you're in here, just to send us a message. Or if you have ideas about the website, if you have feedback, please always send those. If there's something that you feel that isn't right for you as a direct care worker or you as a provider, this would be the place to send us feedback. Or if you have resources, or if you have information or trainings that you've found or uncovered that you thought or think would be beneficial for all, please send them all. Please send all that in. And then of course we have our help, which is really just, again, a larger library of help documents. And lastly, we have our announcements. So we have announcements on the side. From time to time, we'll update it. For the last couple of weeks, we had a free QPR training on there, but that has since closed. So if you come in here, keep an eye out for announcements, because there will be free trainings and all of that good stuff that we are finding. Another thing is that we have two YouTube videos. One that goes that I mentioned at the beginning of this, is that it goes sort of click by click, step by step, how to, if you're a provider, to get logged in and post a job, and also if you're a direct care worker. So I think Brooke is going to drop those in here in just a second. And that's all for me. Thank you very much for your time.
Awesome. Thanks, John. we are buttoned right up against 11:30, but I just want to say thanks for joining us. I did drop a survey link into the chat. I would love if you could take that for us. It should take just a few minutes, but that just really kind of helps us guide these future meetings to make sure they're relevant and it's time well spent for you. So I want to thank our presenters for being here, John for taking us through that awesome website. And yeah, if you need anything in the meantime, our email address was dropped in the chat along with all those resources. But thank you all so much. We appreciate you being here. And if we don't see you before, I hope you have a wonderful holiday season and a happy new year. Thank you.